once again, we're going to talk about a case of real life of Dr. Yackaman. I saw this patient 26 years ago. Imagine that. The patient was presented to me. He was 62 at that time, and he still is very young. And he came because he had an infection. His dentist told him that he needed a root canal, but also he wanted me to determine and diagnose that he has internal resoption. If you want to see a chapter related where I present this case, it's exactly the same, similar situation, and the oral surgeon extracted the tooth. I was very upset that I have an episode with the patient's permission to talk about the situation, why the tooth could be saved. So to tell the person who did the treatment, this is a treatment of 26 years that I'm presenting you that has internal resoption. Internal resoption is, remember, the destruction of the calcified tissues around the root or around the coronal part. It's been, an incognito what is causing root resoption, but it can be, it's very well known, trauma can cause it. My studies on root resoption during the PhD were exactly like that, causing a trauma through bacteria, and then we realized where the resoption was present in the roots. And I tell you that the second day that is a problem, the roots start reacting. The same when you have braces. If the braces have to be speeded up because the patient wants to finish faster, it's recommended to take anti-inflammatory for the first 2 or 3 days to avoid development of root resoption, because it's one of the risks of having braces, and it's well known. It's not like the braces are going to cause it. Is that is one of the risks that can happen in any of the patients. And in that situation, it's good to see your dentist in regular basis. And when you finish your orthodontic treatment, be sure you have your x-rays immediately taken of your full mouth after finishing your orthodontic treatment in order to know if you have any resorption that was caused, as I tell you, can be one of the causes of resorption, but this can happen in any patient. Then we can stop the resorption and treat it, and you will be saving your tooth. So this patient have an infection. We open the case, we let it drain, we clean, we dry, and when we close it, we place MTA. And after placing the MTA, we bring the patient periodically to see if this patient has healed after 1 year. As you see, the healing. What do we see here? This is that the infection was so big that it started getting less, and a year later, still present some of it, but already healing. And what is the healing is that all this darkness now is not. And the internal resorption that we treated here, still the same. Should we have extracted this tooth? What do you think? And place an implant? I don't think so. The patient did not want implants. He wants to keep a fixed partial denture, and he's happy about it. So next time that you hear that you have internal resorption, just learn this is a round figure that you will see around your roots or around the coronal area. It's not bacteria. It's caused by trauma, any type of trauma. You grind your teeth and all the other ones I said, but we have a whole chapter in resorption, what are the causes, and call or text or send me a message to the channel and put a like for us if you have any questions. Thank you.